Hi, Dr. Sampson Davis, and I'm back with my health and survival plan for you. Standing outside the emergency department, right behind me, an ambulance just pulled up. I wanted to take a few minutes to talk to you about Zika virus. It's all throughout the news right now. You're hearing a great deal about it. What is this funny name, Zika virus, that you're hearing all about? So it's an ailment, it's an illness that's caused by a bite from a mosquito. We know that Zika started in Africa and is really prevalent in the tropical areas, including Brazil. And I want to get to that point why it's important. But it's also here in the United States. And so the good news is that the great majority of people who are bitten by mosquitoes that has Zika, that's carried the Zika virus, will have no symptoms. Up to 80% would never know or have any symptomatology. The bad news is that 20% of us who's been bitten by a mosquito that carries Zika will develop fevers, joint pain, you may get a rash, your eyes may turn red, and these symptoms are self-limiting, which means that they will last for a few days and go away. They usually respond and you feel better with Tylenol and some fluids and rest. There's no sort of antibiotic or any vaccine that you could take currently to treat Zika. Now, with the summer games coming up in the Olympics, over 500,000 people are planning to attend. But you're seeing professional athletes pull out, the golfers like Jason Day and basketball players like LeBron James and Stephen Curry is pulling out of the Olympics. They say it's because of rest and they're tired, but the truth of the matter is that people are fearful of Zika. Zika virus, especially transmitted through this mosquito, can cause major birth defect issues. So if you are pregnant or planning on becoming pregnant, then you run a risk of, if you in these areas where the mosquito is very prevalent that carries Zika virus, you run a risk of contracting birth defects with your baby. And the birth defects that we see is what we call microcephaly. If you see the picture of the baby, is a very small head. The baby unfortunately has a small brain, and this causes intellectual delay or dysfunction, and it can cause seizures as well. So, I've thought about going to the Olympics myself, but I don't want to run the risk of contracting Zika. Although I can't have a baby, obviously, but I still can pass it on. We have seen that Zika can be spread sexually through the blood and the semen, and if it's in your bloodstream, it can stay within your body for up to 2 weeks. So it's just too much of a risk to take. So you have to do what's right for you. Personally, I'm not going to take the chance. I think Brazil is behind the 8 ball on this one. Enough hasn't been done to make me feel secure. And so my advice to you, especially if you're pregnant or plan on becoming pregnant, is to proceed with extreme caution. If you do decide to go, make sure you do things like bring your insect repellent, make sure you stay indoors as much as possible, wear long sleeves, and have like an insect repellent netting around your bed. Take those steps to make sure you give yourself the best chances at not becoming infected with the Zika virus.